Yeah, pick you up off the floor.
No, thank you.
Yep.
All right, hello, welcome. Thanks for joining us here on YouTube Live for our Healing at the Speed of Light podcast. My name is Dr. Jason Roundtree. I am a chiropractor and certified medical laser safety officer. I'm also the founder of Laser Therapy Institute. We teach chiropractors, physical therapists, family docs, orthopedists, lots and lots of providers around the country who want to use laser therapy in their clinic. Today, what we're doing, though, is talking more towards patients.
Yes.
That's our Healing at the Speed of Light podcast, more patient-focused.
Well, that's our goal.
Right.
It's the patients. So.
Well, yes,
but we also
ultimately.
need to get on. Yeah. Anyway. Yeah.
No, I like where you're going there. Yeah, we need to get information to our clinicians so they know how to use laser therapy. We also, like you said, the real goal is to help patients understand what light and laser therapies can do and how to find good therapies for them. So, I'm joined today by Christy, who has been my co-host for a while now. So Christy is a certified laser tech, and she is also the grand poobah of developing our online materials. Have you noticed that I give you a different title every time?
You do.
Yes.
You do. I like the poobah.
Yeah, that's pretty good.
A good one.
She's kind of a big deal.
So, well, it's a collaborative effort.
Yes,
so.
Thankfully, because you don't want just pure unfiltered me. We definitely need Christy to help rework that. So, but again, thanks for joining us. We're going to be talking today about nearsightedness or myopia. And so it's kind of an interesting topic. I'm going to start and end this conversation the same way, though. Don't go shining lasers and other lights into your eyes or your kids' eyes.
No.
That's not the goal of today's podcast.
No.
We're simply educating on some of the brand new research that's come out and talking about possibilities for the future. But this is pretty exciting stuff. But again, don't go just shining lights in anybody's eyes.
No, that's the biggest safety issue or concern.
Exactly.
So.
Yes. That being said, let's go ahead and go to the research. So we have 6 different studies that have gone into this one. I will not bore you with all 6, I promise. So the main one, and we'll drop links to all these.
Right. If you're interested, you can go read them.
Yeah.
I mean, we'll make them available.
Yeah, absolutely. The main one that is our kind of main source today, though, is something from February of this year, February 2024. So brand new study.
Brand new.
Yeah. It was published in BMC Ophthalmology. The title of the main study we're looking at is Efficacy of Repeated Low-Level Red Light Therapy on Myopia Outcomes in Children, a Systematic Review and Meta-Analysis. Let's break that down a little bit. We're talking about nearsightedness in kids and using the usefulness of using light therapy to help reduce that. Now, this is something I've been watching for quite a while. There's been studies on this going back several years now. This year and last year, we had 2 different reviews published, which really covered all the research that has been done. So in this particular article, they covered, they looked at 152 studies on this. Wow. And then just selected the top 5 to really review. And this is kind of what I've been waiting for, is a real good overview on the research in general so that we can know more from multiple studies about this, because it's a very interesting topic. It's a potentially great use for red light therapy even in the home.
Wow.
So let's talk about what this really is, though. So myopia is the term I've used a couple of times now, or nearsightedness. It's a very common visual condition where close objects look far away. Where close objects look clear, but the far away objects look blurry. It progresses generally through childhood. So
that's interesting. That's interesting because everyone's wearing glasses. So why is it just a childhood onset?
Right. Yes. Not everyone wears glasses.
Well, true.
I don't wear glasses.
Many people
have some kind of visual difficulty, and this is one that you'll find does onset somewhere in that like age range of 8 to 12, 14, somewhere in there. Kids go from being able to see fine, all of a sudden they can't see things on the board in class, or they're having trouble looking out at distance, and they suddenly need glasses. Both my kids have gone through that. So it's one of those things, very, very common. We'd like to know, though, why it happens. Like, what's going on?
That's the question. Why does it happen?
There's a number of reasons, it sounds like. So, now, what it is overall is the increase in the axial length of the eyeball means it gets longer, essentially, so it loses its rounded shape. This is something that can be brought on by both environmental and hereditary causes. So environmental issues as well as the genetics that play a role here.
So I'm going to stop you right there.
Yes.
So with the environmental, are we seeing an increase these days in this issue because of, environmental effects that we talk about so much?
So yes, but a very specific range of environmental effects.
Okay.
So the environmental effects that might be part of this really focuses on light exposure and focal distance. And what I mean by that is they say that living in the city and then individuals also with higher levels of education, they have a lot more intensive near visual work, so reading, writing, visual work on the computer. That seems to be a link. Other factors predicting a faster progression of myopia were parents having myopia, that genetic link.
Okay.
And then also less time being spent on sports and with outdoor activities in general during childhood. So yes, the environmental factors are a factor. But specifically, it's not an air pollution thing necessarily. It's more of a visual pollution, if you will.
Okay.
Screen time.
Interesting.
Indoor light time.
All the more reason to get out and enjoy the outside environment.
That's right.
Okay.
That's right. So what's happening in that change? These environmental factors. What's going on that would create that? Is it just a matter of like wear and tear? What's going on? They say that oxidative stress and inflammation may be responsible for the altered regulatory pathways in myopia. Now, they say the primary characteristic of high myopia-related irreversible vision loss is choroidal thinning. So not only the shape change of the eyeball, but also the choroid, which is the vascular middle layer of the wall of the eye, that gets thinner. So it's a vascular problem.
Interesting.
And this is, odd that you might have this in kids, but if you've got a rapidly developing, growing body, growing eye, and it needs to adapt to its circumstances, and you have a lot of dim light, close-up visual work, evidently it strains that vascular layer.
Because I like subdued light, so there's a case for maybe more light?
Maybe more bright light, maybe just more outside time. Not to say that you shouldn't have any screen time, or not to say that you shouldn't read, but maybe we need to be outdoors more as kids. Yeah.
Well, I just remember hearing, turn the lights on, you're going to ruin your eye.
Yeah. Yeah. Maybe that dim light reading does have an effect.
Maybe that dim light reading does have an effect.
It could. Not totally sure, but yeah. All right. So they do talk some more about some of these environmental factors. Time spent during reading and close-up work in childhood definitely related to myopia progression during the first 3 years. Myopia throughout the follow-up on long-term was definitely higher among those who watched television for 3 hours a day.
Okay.
So, yeah, pretty interesting.
Yeah.
Obviously, people that have myopia are going to get glasses. You need to be able to see, or contacts or something like that. They do say that there are some preventative techniques that have been used to try and reduce the myopia problem. Increased time in the outdoors certainly seems to prevent it, or at least delay it. And sometimes has some level of protective effect. So yeah, getting outside, getting exposure to natural light. Again, that's not as to say you need to be staring at the sun. That's not to say anything about the safety of UV light. We know UV light in particular can be damaging for sure, but more time outside does seem to be good. One of the interesting things with outdoor light is that if you are outdoors when the sun is at a greater, or I should say smaller angle, so sunrise and sunset before the sun is high in the sky, there is a lower percentage of UV radiation that's reaching you through the atmosphere because it gets filtered out. And there's a higher percentage of red light as well.
Interesting.
That's making it through the atmosphere
as
opposed to the broad spectrum light. So if you're going to choose to have time outside and enjoy sunlight, it is a little bit safer, it seems like, to be early day or end of day, not necessarily just staring at the sun during your lunch hour.
Well, there's just a beauty to that time of day too.
Yeah, there is.
The
there
lighting.
Sure is.
So interesting.
Yeah. So I guess the next thing is we're talking about laser therapy here. So
yeah.
where's the link
Where's
here? Well,
the link
this
here?
particular study was looking at the use of repeated red light therapy for myopia. And so what they did is they took these 152 studies, they selected the very top 5, the 5 best studies out of all the studies been done, and then they combined these 5 trials into their review. Overall, the repeated red light intervention was needed twice a day, 3 minutes per session, 5 days a week. So almost every day, a couple times a day, but not very long. I mean, 6 minutes, 5 times, a week is not that much.
Again, this is not pointing directly in the eye. It's
so some of this was.
Was it?
And that's something else I want to bring up. You cannot just get any red light and shine it in your eye. You need a specific level of safe red light that's not focal like a laser is. It needs to be diffused.
Don't do the LEDs right in your eye.
Don't shove a bunch of LEDs in your eyes. However, in general, if you have like some low-level red light, even at a low intensity, it may be enough. So if you're going to pick a light to have on like as a night light, red is going to probably be better than a broad spectrum white.
Interesting. Okay.
So these researchers, though, they had specific devices for this, and that's what I'm going to say, that you don't want to be just staring into red light. If you're going to be looking at this, you want to be working with a healthcare provider who has the right kind of equipment, who can do something like this at a safe level, or send you home, or recommend a device that will be at a safe level. You can't just grab any red floodlight and stare at it. Right. So they found that looking at these 5 top studies with patients that had treated with red light, that the red light prevented the axial lengthening, the deformation of the eyeball, and also improved the choroid thickness. The choroid being that vascular layer we were talking about that seems to thin. They say, our results showed that repeated red light therapy can better control axial length elongation, spherical equivalence refraction, and subfoveal choroidal thickness better than single vision spectacles within 3, 6, and 12 months when compared to wearing single vision glasses. They say it has slowed down and reversed the myopia progression in a large proportion of children in these studies. This therapy is an effective new alternative treatment for myopia control with good user acceptability, meaning that people do it well, can do it easily, and no documented functional or structural damage. However, the effect of long-term red light treatment and the rebound effect after cessation requires further investigation. So we don't know really on the long term, like multiple years, 10 years. We don't really know how well it works there. And we also don't know how much rebound happens, like how much of this is reversed after you stop using the red light. So those are still things that we are waiting for studies to come out on. So this is very much not a settled science. However, it's encouraging that you have a very safe option like this to prevent people from having to need glasses potentially. But a little bit difficult. You got to have the right equipment. You got to use it every day, multiple times a day, and with kids, that's not always the easiest thing.
That's not always easy. When they say multiple times a day, I don't remember if you said the time frame of each treatment.
They said twice a day for 3 minutes per session.
3 minutes.
They also did note in one of these studies that we're referring to today, though, that they don't really know if doing it longer might be better. They don't know if maybe every day versus 5 days a week. 3 days a week. There's a lot of unknowns, but it looks like sometime in the not too distant future, we'll be able to have a device you can use at home for your kids every day that may prevent them from having to need glasses.
I'm thinking of the goggles like you do for virtual reality type apparatus.
Something like that.
Yeah.
Some of these studies were just using a bundle of red LEDs set a distance away that would shine towards the face. And that was really about all it took. But so we'll see. There's still a lot of development that needs to happen here.
Wow, interesting.
It is. Yes, it is. There's also ongoing studies for red light therapy for things like macular degeneration. So not the kids end of the spectrum, but the older adult spectrum. And that could be really good as well. So we'll just have to watch the research. You can rely on us to bring it to you as it comes out. Again, we're talking about brand new studies. This one just published a couple months ago. hopefully this was entertaining. If you have questions on these studies, you want to look them up, you can go ahead and go to the links we'll provide, or you can shoot us an email, info@lasertherapyinstitute.org.
Interesting. Thank you. Thank you. Very interesting.
Thank you. See you in a week or two. Probably 2 weeks for this one.